Welcome to my channel Health for You. What is placenta previa and its risk? The placenta is an organ that grows inside the lining of your uterus during pregnancy. It connects to the umbilical cord and carries oxygen and nutrients from you to your unborn child. It also moves waste away from your baby. Placenta previa happens when the placenta partially or completely covers the cervix, which is the opening of the uterus. Your baby passes from the uterus into the cervix and through the birth canal during a vaginal delivery. Normally, the placenta attaches toward the top of the uterus away from the cervix. Here is what happens when placenta previa as your cervix opens during labor. It can cause blood vessels that connect that placenta to the uterus to tear. This can lead to bleeding and put both you and your baby at risk. Nearly all women who have this condition will have to have a C-section to keep this from happening. Who is at risk? Placenta previa occurs in about 1 out of every 200 pregnancies. You may be more likely to develop it if you smoke cigarettes or use cocaine, are 35 or older, have been pregnant before, have had a C-section before, have had other types of surgery on your uterus, are pregnant with more than one baby. What are the symptoms of placenta previa? It's possible you won't know you have placenta previa until your doctor finds it during a routine ultrasound. The most common sign is bright red bleeding from the vagina during the second half of your pregnancy. It can range from light to heavy and it's often painless. But some women also have contractions with the bleeding. Bright red vagina bleeding without pain during the second half of pregnancy is the main sign of placenta previa. Some women also have contractions. In many women diagnosed with placenta previa early in their pregnancies, the placenta previa resolves. As the uterus grows, it might increase the distance between the cervix and the placenta. The more the placenta covers the cervix and the later in the pregnancy that it remains over the cervix, the less likely it is to resolve. Bleeding is the primary symptom of placenta previa and occurs in the majority 70 to 80% of women with this condition. Vaginal bleeding after the 20th week of gestation is characteristic of placenta previa. Usually the bleeding is painless, but it can be associated with uterine contractions and abdominal pain. Bleeding may range in severity from light to severe. When to contact your doctor, make an appointment if you have bleeding during your second or third trimester. If it's severe, go to the hospital. What is the treatment for placenta previa? Treatment of placenta previa depends upon the extent and severity of bleeding, the gestational age and condition of the fetus, the position of the placenta and the fetus, and whether the bleeding has stopped. Caesarean deliveries, C-section is required for complete placenta previa and may be necessary for other types of placenta previa. A caesarean delivery is usually planned for women with placenta previa as soon as the baby can be safely delivered, typically after 36 weeks gestation. Although an emergency cesarean delivery at an early gestational age may be necessary for heavy bleeding that cannot be stopped after treatment in the hospital, women who are actively bleeding or who have bleeding that cannot be stopped will be admitted to the hospital for further care. If there has been little or no bleeding or the bleeding has stopped, bed rest at home may be prescribed. Home care is not always appropriate, and women who remain at home must be able to access medical care immediately. Should bleeding resume, women with placenta previa in the third trimester of pregnancy are advised to avoid sexual intercourse and exercise and to reduce their activity level. Women with placenta previa who experience heavy bleeding may require blood transfusions and intravenous fluids. In some cases, tocolectic drugs, medications that slow down or inhibit labor, such as magnesium sulfate or terbutaline, are necessary. Corticosteroids may be given to enhance lung development in the fetus prior to cesarean delivery. What are possible complications of placenta previa? If you have placenta previa, your healthcare provider will monitor you and your baby to reduce the risk of these serious complications: bleeding, severe, possibly life-threatening vaginal bleeding, hemorrhage can occur during labor, delivery, or in the first few hours after delivery. Preterm birth, severe bleeding may prompt an emergency C-section before your baby is full term. Placenta previa can be associated with other abnormalities of the placenta or of the umbilical cord. Some studies have shown a reduction in fetal growth associated with placenta previa, and the presence of the placenta in the lower part of the uterus makes breech or abnormal presentation of the fetus more likely. The bleeding of placenta previa can increase the risk for premature rupture of the membranes, leading to premature labor. Placenta excreta is a serious complication that occurs in 5% to 10% of women with placenta previa. Placenta excreta results when the placental tissue grows too deeply into the womb, attaching to the muscle layer, resulting in difficulty separating the placenta from the wall of the uterus at delivery. This complication can cause life-threatening bleeding and commonly requires hysterectomy at the time of cesarean delivery. Lastly, as with our other complications of pregnancy, placenta previa can have a significant emotional impact on the pregnant woman. Can placenta previa be prevented? Placenta previa cannot typically be prevented. In some cases, risk factors for the development of placenta previa can be eliminated, such as smoking cessation. What is the prognosis outlook for placenta previa? The majority of women with placenta previa in developed countries will deliver healthy babies, and the maternal mortality death rate is less than 1%. In developing countries where medical resources may be lacking, the risk for mother and fetus may be higher. Natural treatment for placenta previa. What is placenta previa? Placenta previa occurs in about 1 out of every 250 pregnancies. Many times, previa is detected in the third trimester, but it's sometimes spotted at as early as 17 weeks, usually either in a routine ultrasound or because some bleeding or pain is occurring. In this condition, the placenta lies low in the uterus and may grow to partially or completely cover the opening of the uterus, the cervix. There are two types of placenta previa: minor and major. Major placenta is in lower uterine segment, but the lower edge does not cover the opening of the uterus. minor. Placenta is in lower uterine segment and the lower edge covers the opening of the uterus. The concern with placenta previa is that the placenta blocks the birth canal either partially or completely. While you can have a vaginal birth with placenta previa, the placenta could be pulled from the uterine wall when the cervix dilates during labor. This could cause bleeding and potentially be harmful to you and your baby, meaning a C-section delivery may be necessary. Many cases of placenta previa resolve themselves as the uterus grows and the placenta naturally moves upward. In more pronounced cases, the previa completely covers the cervical opening and will not move far enough up, regardless of treatment. In these cases, a caesarean section delivery is a necessary miracle. Because of the risk, if you are planning a home birth, placenta previa will need to be resolved before your midwife will give the go-ahead to birth at home. Chinese medicine's approach to placenta previa. Deborah Bates, 2016, notes in her book Acupuncture in Pregnancy and Childbirth. Although it has been estimated that as many as 30% of placentas on ultrasound are positioned low at 20 weeks gestation, less than 1% require further monitoring by 32 weeks, with only a small portion of these requiring any medical intervention. Traditional Chinese medicine views placenta previa as sinking Q. Additional symptoms that such a patient may experience might include digestive complaints, frequent bruising, varicose veins, hemorrhoids, and a tendency to depression. The goal of treatment is raise and fortify the QI, stop bleeding, and calm the fetus. TCM treatment for placenta previa. TCM practitioners use two techniques in treatments for placenta previa: herbal formulas and acupuncture. Usually, practitioners employ a combination of these two treatments, which provide a safe treatment option that can be effective in helping to resolve this condition in cases where the previa is minor. Herbal formulas. An experienced TCM practitioner will administer an herbal formula designed specifically for your condition. Biju Zong GQ Tang is a classic Chinese formula used for raising Q. It's very safe for pregnancy and is often used to prevent recurring miscarriages as well as for treating placenta previa. Acupuncture. Acupuncture treatments are quite successful in minor cases of previa. Your practitioner will recommend a schedule of acupuncture sessions to treat your individual condition. Due 20 is the key acupuncture point for treating placenta previa, located at the very top of the head, and it's very effective at raising Q. In many own acupuncture practice, I have treated many moms with placenta previa. In nearly all cases of partial previa, the condition resolved itself while the patients were undergoing regular weekly acupuncture and taking herbs daily. In more pronounced cases where the placenta was too low lying to resolve, treatment helped to improve the patient's underlying imbalances, which seemed to improve their overall health and sense of well-being.